Diuretics are a class of drug that cause the increased passing of urine. They have been commonly used as a first-line treatment of hypertension, heart failure, and liver disorders. They are currently banned in sports for two reasons. First being that it can lower the weight of competitors, thereby improving performance in some fields, such as gymnastics, and it can affect assignments into weight divisions, such as in boxing. It achieves this by lowering the weight of competitors by decreasing their blood volume. Second major reason for its ban is that it can mask other illicit substances. Since diuretics increase the amount of water in urine, it has a direct effect on the concentration of other substances excreted through urine. This can make it more difficult when examining urine for the presence of other banned drugs. The WADA has permitted the use of diuretics when it has been prescribed for therapy, as outlined in the International Standard for Therapeutic Use exemptions. A 2013 WADA review found that of 269,000 samples taken from Olympic and non-Olympic athletes tested for illicit drugs, almost 6,000 positive samples were found. Of these 6,000, almost 7% were found to be diuretics. The two most commonly used diuretics were furosemide and hydrochlorothiazide, of which 145 cases of furosemide and 125 of hydrochlorothiazide were found. Furosemide is a loop diuretic. Loop diuretics all act on the sodium-potassium chlorine symporter in the ascending limb of the loop of Henle. Here it inhibits this symporter by competing at the chloride binding site. ROMK, the renal outer medullary potassium channel, uses the potassium from this symporter to flush potassium back into the ascending loop of Henle for the purpose of making it positively charged. This in turn encourages the push of calcium and magnesium out of the lumen. Blocking of the chlorine binding site thus inhibits the absorption of potassium, magnesium, chloride, sodium, and calcium from the ascending limb. This reduces the osmotic potential between the lumen of the nephron and the collecting ducts, which gives us its final effect, more urine production, this urine being composed mainly of water. With regards to sports, the urine production is sufficient to decrease blood volume and by extension, weight. Hydrochlorothiazide. Hydrochlorothiazide is a thiazide diuretic. This inhibits water reabsorption in the nephron by inhibiting the sodium chloride symporter SLC12A3 in the distal convoluted tubule. This symporter causes sodium and chloride to be transported into the epithelial cells lining the distal convoluted tubule. Normally, the sodium chloride symporter transports sodium and chloride from the lumen into the epithelial cells lining the distal convoluted tubule. From there, it is transported into the basolateral interstitium through the sodium-potassium ATPases on the basolateral membrane, thereby causing an increase in the osmolarity of the interstitium and establishing an osmotic gradient for water reabsorption. The action of hydrochlorothiazide causes sodium to not be reabsorbed from the distal convoluted tubule, effectively reducing the osmotic gradient and water reabsorption throughout the nephron. Loop and distal tubule diuretics are not without their side effects. With regard to furosemide, these side effects include hypervolemia and hypertension from excessive sodium and water loss, hyperkalemia and metabolic alkalosis from potassium loss, hypermagnesemia, acute gout precipitated by an increased uric acid production, and excessive diuresis. With regard to hydrochlorothiazide, these side effects include an increase in urinary frequency, erectile dysfunction, hyperchloremic alkalosis from decreased uric acid excretion, impaired glucose tolerance from the inhibition of insulin secretion, hypernatremia, and encephalopathy precipitated by hyperkalemia. In conclusion, while diuretics have their beneficial effects as a therapeutic, Their inappropriate use in the sporting world as a performance enhancer and masking agent has motivated the drive for it to become prohibited worldwide by the International Olympic Committee.